It is important to note that since autism is a spectrum disorder, the symptoms can differ significantly from person to person. Food aversions and problematic eating behaviors are fairly common. Although most parents struggle to feed their children certain foods, particularly those who are picky eaters, children with autism often have more complex eating behaviors. The child can lack the nutrients he or she needs to thrive if these behaviors lead to unhealthy lifestyles. Welcome to Autism Answers. Our mission is to provide you with informative facts about autism that are easy to digest, as well as help broaden perspective regarding autism. In this video, we will discuss food issues and autism eating habits. With that out of the way, let's get started. In light of these questions, how do you determine if you should intervene if your child refuses nutritious meals or exhibits potentially dangerous behavior at the table? You may be concerned about your child's food selectivity and certain mealtime behaviors, but with the right therapy and support, you can develop new healthy eating habits. You can use this guide to help navigate the challenges you are currently facing as you work to set your child up for long-term good health. Children with autism are 5 times more likely than their peers to develop feeding issues, according to a number of sources. A recent study at Penn State found that 70% of children with autism exhibited atypical eating behaviors, which is 15 times more common than neurotypical children. An atypical eating pattern may be a sign a child has autism that needs to be screened for. Children as young as 1 year old may exhibit these behaviors. It is possible that feeding problems such as picky eating, refusal to try new foods, or fluctuating hunger are temporary. A picky eater typically tries new foods as he or she grows, but a child with autism will remain selective in what they eat. This is the most common feeding concern. For example, children may still like baby food. Some children will typically eat a diet consisting primarily of grains, such as bread, pasta, and other carbs. It's possible that your child will avoid an entire category, such as vegetables or protein. In this case, when they're given foods they dislike, they may also display behavioral problems. It's important to discuss feeding concerns with a healthcare provider as soon as possible. The more reinforced habits become, the more difficult they are to change. Autism can cause children to experience great anxiety, which can lead to sensory aversions or fears of trying unfamiliar foods. These feelings of anxiety can shut down a child's hunger, and the child may not eat enough to meet their daily nutritional requirements. There may be sensory issues at mealtime, and your child may develop a preference for foods that feel a certain way in his or her mouth. Some prefer soft foods, such as yogurt or ice cream, while others prefer crunchy foods, such as chips. This limits the foods your child can eat. You should also pay close attention to how your child reacts to certain textures and temperatures. You may also experience disruptive behaviors. It can be difficult to get any child to sit at the dinner table for extended periods, but children with autism may take these challenging behaviors to a whole new level. It involves repeatedly running away from the table or throwing utensils. It may also result in underdeveloped oral muscles. Children who eat almost only soft foods may have poor muscle development, as well as pocketing food without swallowing it. There is no evidence that food selectivity causes weight loss in children with autism. The opposite is more likely to occur. It is common for children with autism to prefer starchy and snack foods, which increases their risk of obesity and diabetes. In addition, children eating a narrow variety of foods can cause growth and development problems, such as poor bone growth and vitamin and mineral deficiencies. Autism is often characterized by a low level of vitamins B1, B6, B12, A, and D, as evidenced by research. Protein and calcium deficiencies are also common problems. Before we continue, we'd like to ask a few moments of your time. If you want to support us and our mission to spread awareness about autism, please leave a like and click on the subscribe button. This would help us create more engaging content for you. Now moving back to where we left off. It's important for all family members, including siblings who do not suffer from autism, to address mealtime behavior problems, which research has also examined. Despite the fact that many forms of therapy focus only on the child, family, and parental factors can have a significant impact on the child's immediate and long-term effects. In order to make mealtime more relaxing for the entire family, you can take steps to make your child with autism more comfortable with trying new foods. When children on the autism spectrum display challenging eating behaviors, the first step is to rule out organic causes. Children with autism can suffer from any of the same childhood GI disorders as other children. The difference is that children on the autism spectrum may not be able to effectively verbalize what they are experiencing. The most common GI issues that affect children, such as acid reflux and constipation, must be excluded from the diagnosis. Working with a therapist who specializes in autism spectrum disorders is important if a GI disorder isn't the cause. Using a range of techniques for addressing mealtime behavior and selective eating, they will help you design a treatment plan. Understanding why your child refuses to sit at the table or try new foods is key to developing these strategies. They will often focus on structure and routine as well as persistence and patience. To better track your child's progress as well as challenging that continue to arise, it's beneficial to keep a journal of what you feed your child and their reaction. You can discuss this with your child's therapist if you would like to improve food preference through taste exposure. It's possible to use interventions that have been proven to be effective, even if your child has previously resisted this method. Some children benefit from visual support, such as charts that specify what meals or snacks they will try throughout the day. Token systems can also be very effective. You may start with pea-sized portions and work your way up to a spoonful of new food using stimulus fading. Different children have different needs. You don't have to be discouraged if your child's fussy eating habits don't improve right away. It can take time and effort to find new foods that work for your child. Also, your child's preferences might change as they get older, and they may be willing to try new foods. You can encourage your child to try new foods by following these tips. 1. Sharing meals with others. In addition to promoting healthy and eating habits, you prevent rewarding fussy eating behavior with separate or special meals when you share regular meals and snacks with your child. If you use this approach, give your child food you know they will eat as well as new foods, and let them decide whether they want to try the new foods. 2. Identify familiar foods and introduce new but similar ones. New foods might take your child a while to become comfortable with if he or she finds change difficult. By introducing foods that are similar in texture, color, or smell to other foods that your child already enjoys, you can help him or her accept new foods. Put the new food nearby the foods your child enjoys. To get your child used to the smell, feel, and taste of broccoli, you can put it in near some cauliflower. You can also let your child sniff or lick it. Just let your child know they don't have to eat the broccoli. This might take several meals for your child to even try the new food. 3. Make sure you follow routine. Regular meals and snacks encourage a better appetite at mealtimes. This also sends a message that healthy eating is a family tradition. 4. Present food in a different way. Changing the way you serve food might encourage your child to try new foods over time. For example, you could use a different plate or pack a healthy snack in a favorite lunch box. 5. Making new foods comfortable outside of meal times. The pressure your child might feel about trying new foods can be reduced if you introduce new foods outside of the kitchen or the family table. You could, for instance, go to the supermarket or grocery store together to look at different foods. Look at pictures or different foods, prepare new meals together, and try new recipes. You can also explore new foods through play, for example, squashing, painting, stacking, or smelling. The table can be a good place to introduce new foods as your child becomes more comfortable with them in these contexts. 6. Milk drinks should be limited. There are autistic children who drink a lot of milk and don't eat much food, so they may not have enough iron. If you limit the amount of milk your child drinks each day, you'll be able to encourage your child to eat more. It is common for autistic children to mouth or eat non-food items such as dirt, hair, coins, soap, or fabric. It's called pica. You could try substituting non-food items from snacks and praise your child whenever they choose a food item over a non-food item. Your pediatrician or other health professional can help you manage your child's pica. And that's what we have for you today. What are your thoughts? Let us know in the comment section down below. If you want more content related to this topic, make sure to check out our channel. Take care, and we'll see you in the next video.